So, mineral disorders of the bone. Firstly, we have to know the composition of the bone. Bone, it is made up of 25% of the organic matrix, and which consists of the osteoblasts and also the protein. Protein, it is a type 1 collagen, and next 75% it is by the inorganic matrix, that is by the calcium and also the phosphates. Calcium in the hydroxyapatite forms, and next water constitutes around the 5% only. So if proteins and also the cells will form the osteoids along with the minerals will form the bone. So next, what are the pathologies if there is any increase of the osteoclastic activity, it leads to Paget's disease, and defective or the decreased activity of the osteoclast will lead to the marble bone disease, which is osteopetrosis. So marble bone disease because the bone become white and also the brittle like the marble, and proteins are if there is any genetical defects in the type 1 collagen, the disease is called as osteogenesis imperfecta. So if there is a defective in the deficiency of the vitamin C, it is known as the scurvy. In minerals, if it is adult, if there is deficiency of the minerals, it is known as osteomalacia. In the children, it is known as the rickets. So osteoporosis, here the minerals and also the osteoid component will also be low. Therefore, the serum minerals are normal. So osteoporosis is of two types: primary osteoporosis and the secondary osteoporosis. Primary is a age-related or the postmenopausal, whereas secondary osteoporosis, it is a drugs, mainly the steroids, proton pump inhibitors, antacids, anti-epileptics, and all alcohol, etc. So the patient may come up as an elderly female who complain of the pain in the vertebrae or the hip or distal end of the radius and the upper limb. All three are the cancellous bone. They are soft. So pain, it may be after trauma or non-traumatic. If she complains of the pain after trauma, it is a localized change only. There will be a compression fracture, which is impacted fractures of that. If non-traumatic, there it is X-ray. They shows the diffuse changes. So codfish vertebrae, and also the davaga hangs on the upper part of the spine, which leads to kyphosis. But serum minerals are normal because both osteoid and also the mineral components is decreasing. What is a gold standard investigations for the osteoporosis? It is a DEXA, which is a dual energy X-ray absorptiometry. If it is less than 2.5 standard deviation, it is considered as osteoporosis. If it is between -1 to -2.5, it is osteopenia. If it is more than -1, it is normal. Here we see the T-score. T-score means comparison of the density of the patient with a healthy individual of the same sex young individual. So treatment, here we have to inhibit the resorption and promote formation. So inhibit resorption is by the bisphosphonates. Firstly, we use the bisphosphonates, alendronate, ibandronate. It should be given only for the 1.5 to 2 years because there is an increased tendency of the fracture. Next, calcitonin should nasal spray in alternative nostrils. Next, SCRM and also the estrogen therapy. Next, drugs which promote the formation of the bone or the teriparatide synthetic analog of PTH should be given as a daily subcutaneous injection, and also the calcium daily dose of 800 to 1300 milligram per day, and calcitriol, and dual actions is presence with the strontium ranulate and denosumab, which is an inhibitor of the Lang-Reigan. And next, newer drugs are the abaloparatide and also the romosumab. Disorders of the mineralization of the bone or the rickets. So rickets of prematurity, it is 80% of the minerals is transferred to the fetus in the 3rd trimester. So because of the prematurity, these minerals are not transferred to the baby in the 3rd trimester. There will be decreases serum minerals in the child. The deformity of the knee there is a deformity of knee and also the leg, that is xenovarum. Normally it should be present till 2 years. After 2 years it will be straight. So if the X-ray shows there will be deformity or the irregular metaphysis is seen. If we do the clinical evaluation, First side to be examined is the skull because craniotypes, so that is softening of the skull is present. Mainly the parietal and occipital bones are aliously softened, and next frontal boning and delayed closure of the frontalis, and chest, it shows the rickety closure, which are the painless costochondrial prominence are present, and pectus carnatum, which is a prominence of the sternum, and Harrison's groove, which is a depression around the attachment of the diaphragm at the subcostal margins. Next, short stature, and diaphysis shows bowing, and metaphysis shows splaying and fraying, and knee shows xenovarum valgum, and windpipe deformity is seen, and hip shows coxa vara. Treatment should be of the marmoset splint, and also the calcium and vitamin D supplementation should be given. So how we monitor, and if a radiological monitor, there will be appearance of the white line around the metastasis on the X-ray can be seen within the 1 to 1.5 months. Other way is by the metabolic assessment. Initially the level of alkaline phosphatases are very high after the supplementation. So the alkaline phosphatase level becomes normal after 1 to 1.5 years of the treatment. Osteomalacia, it is a softening of the bones. The presentation will be history of the minimal trauma leading to the pain, and the fracture line is surrounded by the sclerosis leading to giving appearance of the pseudo fracture or the milkman's line or the loser zone. More common site, it is a pubic rami, and later the neck of the femur, and next it is the ribs, olecranon, or later margins of the scapula, and we have this condition called as protrusio acetabular or the orthopelvis, that is protrusion into the pubic rami. So protein problems, that is scurvy. It needs 6 to 12 months of vitamin C deficiency to get manifest as scurvy. So it is not seen in the neonates. So main functions of the vitamin C is it causes the hydroxylation of the lysine and proline. So this will causes the cross-linking of the collagen fibers. It maintains the integrity of the vessels. If there is no cross-linking in this disease, because it leads to predisposing to hemorrhage, and clinical manifestations are the bleeding gums, pseudo paralysis, and the scorbutic rosary, that is painful, sharp costochondrial prominences are present, anemia, and also the poor wound healing is seen. Extra features are we can see this osteopenia, ground glass appearance, and pencil tip cortex, and Wimberger's rim, white line of Frankel, and also the pelican spur is seen. And treatment is with the vitamin C. Next, osteogenesis imperfecta, which is also called as brittle bone disorder. It is a skeletal dysplasia or the hypoplasia, which is characterized by the genetic defect in type 1 collagen. It is autosomal dominant or the recessive inheritance, and clinical features, there will be increased tendency for the fractures, but the rate of healing is normal. So more commonly it is femoral fractures are more common, and growth arrests may be associated due to repeated fractures, and there is a hyperlaxicity of the ligaments with hypermobility of the joints. Ocular involvement, that is the blue sclera and Saturn's ring or the arcus juvenilis is present. Investigation, serum calcium and serum phosphates are normal. Alkaline phosphates are increased because of the increased healing. So diagnosis, we see this multiple fractures are present in the X-ray, and prenatal ultrasound also shows us the multiple fractures, and treatment is by the seat kebab osteotomy or the Sopel-Miller procedure in the severe deformity, conservative by the hip spica. And the cell, it is a Paget's disease or the osteitis deformitis. So there is a increase of the osteoclastic activity in the Paget's disease. Therefore, there further increases the osteoblastic activity. Therefore, both markers of formation and bone resorption will be increased. So Paget's disease may occur after viral infections, trauma, or genetics. More commonly seen in the elderly who are more than 50 years. More commonly it is the pelvis and also the tibia. 3 phases are present: lytic phase, mixed phase, blastic phase. In the lytic phase, usually diffuse absorption will be present. So in skull or skull osteoporosis, it's called as circumscripta. In long bones, it shows a candle flame or the blade of grass appearance. In mixed phase, in the skull we see the cotton wool appearance. In the vertebrae, however, or the picture phase vertebrae are seen, that is peripheral white and central black. Differential diagnosis is a Ragages is fine, where either side it is white and center it is black. Rugger's spine is seen in the brow, that is renal osteodystrophy, Brown's tumors, and also osteopetrosis. And blastic phase, it is a cranial nerve compressions of the 2, 5, 7 and 8, pathological fractures and osteosarcoma. Treatment is with bisphosphonates and calcitonin, which decreases the clastic activity. Next, osteopetrosis. Osteopetrosis is known as a marble bone disease. So it is a skeletal dysplasia. It is defective of the osteoclast, increased number of the osteoclast, increased markers of the bone resorption, and only osteoblast is functional, so increase of the bone formation markers. So blast will enter the marrow, and primary hematopoiesis will phase, leading to anemia, pancytopenia, and extramedullary hematopoiesis will start, which is a secondary hematopoiesis leading to hepatosplenomegaly. We can see the expansion of the bone on ends. It is known as the early Meyer's flask deformity.